Working at a busy dermatology practice, I see quite a few cases of irritable, dry skin. Now, the problem with irritable, dry skin is that, first of all, it is very common and it is caused by various conditions. There is the genetic tendency of people to have drier, more sensitive skin. And then there are chronic skin conditions, either self-induced by virtue of excessive and misdirected skincare, or sometimes a skin condition that can actually induce skin sensitivity over the affected area. Now, what people do automatically in our culture, and actually way beyond the boundaries of our culture, is that they tend to treat dry, sensitive skin with more abrasion and more efforts to clean, thinking they're dealing with an infection or a cleanliness or a hygiene issue. That usually digs people deeper into the hole and makes the problem worse. Here I'd like to discuss a few symptoms and signs that are showing up on the skin where the skin is telling you, don't tread on me, back away from what you're doing. These are symptoms that are very easy to recognize. You may actually have recognized them already, but have misinterpreted them as a sign for you to do more. In many cases, it is a sign to back away and do less. And let's review those symptoms and signs and see what you're suffering from, and maybe we can make things better for you. The first symptom or sign is a persistent sensation on the skin. Now, persistent sensation on the skin is something quite abnormal. The normal skin feels like nothing. I'm sure you're already aware of that when you think about it. Normal skin does not feel like anything unless there's a temperature change around it, and you'll sense that for a moment or for as long as the temperature changes, or you're touching an object with your hand, whatever it is, you'll definitely feel that sensation over the hand or over the skin that is touching the other object, or sometimes being aware of the skin part actually transmits a certain sensation or an awareness that that skin part is paid attention to. But apart from those examples, normal skin does not usually feel like anything consistently. Now, if you have a persistent sensation on your skin, such as itch, burning, pain, tightness, or ants crawling on the skin in certain conditions, you may actually be experiencing irritation of the skin. That's a sure sign for you to back away from whatever it is you're doing. In case you're abrading the skin, trying to clean it with hot water, you're trying to clean it with anything that's chemically abrasive like a soap or a detergent or a cleanser or a wash or a shampoo or whatever it is that you're doing chemically, or trying alternatively to use a physical means of abrading the skin, such as scrubbing or brushing or loofah or exfoliation, or a washcloth or a glove, or any one of these devices that is used to abrade the skin and scrub and exfoliate dry skin or irritated skin. All these techniques can actually make your irritable, sensitive skin worse, as I've mentioned in previous videos. Now, that persistent sensation over the area is a sure sign for you to back away from these things. Consider moisturizing the area if that is the appropriate response. In most cases it is. One case is the exception, which is athlete's foot and ringworm of the body. These cases can actually become worse, so be mindful of the possibility that moisturization may not be your solution. But that being said, abrasion of the skin is never the solution for sensitive, irritated skin. It will invariably make your problem worse, so you want to back away from these things if the skin is transmitting those sensations consistently over the area. Another sure sign that the skin is irritated is redness or blushing of the skin. Now, that can look a little different depending on the skin tone of the person. In very light-skinned people, the redness that I'm talking about is more like pinkness or maybe intense redness. And the darker the skin color becomes, and the darker the skin color is, that redness can appear as purpleness, sometimes a little darker on the darker side, but it's definitely a distinguished reddish or purplish hue or coloration to that area. That is another sign that that area is irritated for whatever reason, whether it's chemical irritation, allergic irritation, or some other form of irritation by means of infection or other causes. So in those cases where the skin is persistently red, be sure to back away from any practices that could sensitize your skin, such as the practices that I've mentioned in the earlier segment. Another sign of irritable, dry skin is flakiness or scaliness of the skin. That can appear as anything from cracked, dry skin to sometimes even flakes that appear on the surface of the skin in various shapes and colors. that is usually a sign for you again that the skin is dry and irritated for whatever reason, whether it's just dry sensitive skin or other conditions such as dandruff, seborrheic dermatitis, in certain cases of perioral dermatitis, which is a close relative of rosacea. We can see flakiness of the affected skin on the face. And there are other conditions that can make the skin flaky and scaly. All of those conditions generally benefit from avoidance of techniques that are used to abrade the skin. Again, the hot water, the chemical abrasives, and the physical abrasives. All of these will make most cases of such dry, sensitive skin worse off, and you're better off backing away from them. Another sign that the skin is irritated or not doing well are pimples on the skin. Those are red bumps. They're usually distributed around the follicles, around the hair follicles, such as in the cases of acne or folliculitis. These are usually red bumps or pustules, meaning whiteheads, and they can appear as multiple lesions at the same time in cases of folliculitis and acne, or appear as a single pimple. That's another sign for you to do very little to the area so you don't aggravate the condition further. Again, avoid the hot water. Avoid the washing and the scrubbing of the area to make it better. In certain cases of folliculitis and inflammatory acne, those cases can benefit from antibacterial washes, but you'd better consult with your dermatologist to figure out what's the right antibacterial wash for you and what would make the difference over time. That being said, applying that wash for things as they come, for acne as it comes, or folliculitis as it comes as a spot treatment over a very limited time can usually backfire by irritating that area further and not preventing the next crop of lesions to appear. So in many cases of acne or folliculitis, the treatment is long-term. That means we're actually treating the next crop of acne or the next crop of folliculitis. So the treatment has to be maintained over a long period of time to get you to that remission, meaning for the condition to disappear, to come under control. And then you can consider with your dermatologist coming off the treatment that is applied over a long period of time and moving on to something that's called maintenance treatment, which is a less frequent application of the medication, as well as hopefully weaning you off the medications altogether so you can actually live your life and focus on other things. If you've enjoyed this video so far, share, like, and subscribe. Put a comment in the comment section and tell me what type of sensitive skin condition are you suffering from, and which one of the practices that I've mentioned that could be making your condition worse have you been using thinking that they would actually benefit your condition? I'd love to hear about it in the comment section. More great content coming your way right from this channel. Thanks for watching, and God bless.